Now, viva can be very tough to master. In addition to the sheer pressure of reading through your long books, there is the ghastly fear of the invigilator. What type of questions they may ask. But do not worry, once you have all the knowledge at your fingertips, the rest will be smooth sailing. Coming to the topic, the humerus. Let me make things systematic for you and start with the basics. This is the proximal end and the distal and the shaft. The other bony landmarks that we have over here are the head of the humerus that is located on the proximal end, and then we have the distal tubercle, which is also known as the greater tubercle, and then we have the lesser tubercle that is located over here. So you have to identify all of these bony landmarks over here. Then we have the shaft of the humerus. Moving on, we have the two fossas that are located on the distal end of the humerus. And then we have the medial epicondyle and the lateral epicondyle. So now you may be asked, how will you distinguish the anatomical position? Is this bone the right-sided or either it is the left-sided bone? Over here, you will simply identify the head of the humerus, which is to be directed upward, backward, and medially. Look carefully. At the distal end, you'll find the radial and the coronoid fossa, which should be placed anteriorly, while the olecranon fossa should be placed posteriorly. This tells you that this is the right-sided humerus of your body. Talking about the joints, if you recall, the humerus joins the axial skeleton via which joint? The glenohumeral joint. And how is this glenohumeral joint formed? This is the anatomical position of the scapula, and the glenoid fossa, this will accommodate the head of the humerus, thus making the joint which is stabilized by multiple ligaments and the rotator cuff. Now let us recall a few facts about this joint. This is a ball and socket joint with a range of movements at this particular joint. For instance, we have the adduction, abduction, and circumduction that is being exhibited over here. Now, another joint is the elbow joint, which is formed by the head of the radius, which is articulating with the capitulum of the humerus. On the other hand, we have the ulnar notch, which is the trochlear notch and is articulating with the trochlea of the humerus. Now, this elbow joint provides the movements such as flexion and extension, which is exhibited over here. I hope the basic concepts are clear and will help you ace through your professional exams. Comment down below how helpful was this video. Which other bones would you like us to cover? Stick with us, there is more exciting content coming on sqadia.com.